Hello, ladies and gentlemen. My name is Dr. Chernik Volodymyr. I'm a medical doctor and aesthetic practitioner. And today we are going to talk about the problem of hair loss and hair thinning, and the most important, on how we can solve this problem. So over the past 2 to 3 decades, medical practitioners and researchers have been searching for new ways and methods to help people suffering from hair loss problems. The degree of hair loss might be different from individual to individual. For example, sometimes it is just some frontal hair recession for some male patients. In another case, it might be total hair loss from the frontal line back to the vertex that you can hardly conceal. On the same note, the problem of telogen effluvium and androgenetic alopecia in the female population has always been and will constantly be influencing patients' psychological well-being. With the advances in technique available today, we can truly provide natural and aesthetically pleasing results by using natural, minimally invasive and, of course, non-invasive methods of treatment. And what I'd like to discuss with you today, particularly how we can help our patients and clients, and which minimally invasive and non-invasive therapies we could offer them. So nothing on hair transplant and surgery today, okay? Hopefully you'll find this video helpful if you're looking to some way to thicken and improve the structure of your hair. And if you're working in aesthetics, you might employ certain tips that will be mentioned later into your treatment modalities, okay? So we must admit that hair loss is just a symptom, alright? Not an actual existing disease. So be sure you've done all the necessary examinations before getting to the treatment. Because, as we know, every case is individual and the treatment modality has to be adjusted accordingly to satisfy the particular therapeutical needs of any patient. Okay, here we start. So, first of all, de-stress yourself, alright? Stress is a factor leading to many debilitating diseases and conditions, and hair loss is, of course, one of them. Stress is a common cause of temporary hair loss, which we call a telogen effluvium. Suddenly, people start to lose more hair than they usually do, and losing more than 100 hairs per day isn't common, alright? So, and if the patient notices a more visible scalp with the fewer hairs or mounds of hair on the pillow or in the shower drain, it could be a sign of excessive hair loss. While telogen effluvium is characterized by the loss of handfuls of hair and difficulty maintaining frontal hair density. Any stressful situation can trigger hair loss, including pregnancy, chronic illness, injury, relationship issues, and maybe even some financial concerns, of course. Most of those conditions will spike levels of cortisol, the hormone of stress, affecting many processes in our bodies, including hair growth. Telogen effluvium might even become chronic when a factor of the cause that leads to hair loss lasts for too long. Stress can push hair follicles into a resting phase, and so it doesn't produce any new hair strands. As a result, hair can fall out more easily over time, even if you're washing, combing, or touching it. Now, to counteract stress and protect your hair, try these tips. Learn and practice some relaxation techniques, such as deep breathing, meditation, or yoga, nidra yoga, and do it regularly. Get regular exercise, which helps manage stress and its effects. Then, seek professional help from a therapist if such a condition lasts for too long. And of course, you should spend time only with positive people, not with the toxic ones. Eat a healthy diet if your doctor recommends it, and, well, we'll talk about it in a more detailed way later, but yeah, I want to point it out as well. And then treat your hair with care when washing, drying, and styling it. Second tip, why don't you try a scalp massage? Some of you might say, well, that's another perfect solution to distress yourself, and I'm not going to argue. But the science behind hair growth improvement in this case is different. So is it just a myth, or is it true that scalp massage has benefits for hair structure improvement? Though research is limited, there may be some promise to the theory depending on your hair structure condition and needs. According to a small study from 2016, researchers concluded that regular scalp massages might lead to thicker hair. This study involved 9 men who received a 4-minute scalp massage each day for 24 weeks. At the end of the study, it was found that the men had thicker hair than at the start. Additional research from 2019 supported these findings. This study was based on survey responses from 360 participants who had followed specific instructions by doing twice daily scalp massage to improve hair loss. According to self-reported findings, approximately 69% of participants reported that their alopecia had improved. So what's the theory behind it? It is thought that a scalp massage might help dilate blood vessels, okay? They become bigger. So especially those vessels beneath the skin, thereby encouraging hair growth and hair thickening. Although research is limited, scientific evidence shows that while scalp massages can't cure hair loss, they do show promise in promoting hair growth. You can give yourself a scalp massage using your fingertips or a scalp massaging tool, alright? You can use it as well. And you can also get a scalp massage from a trained massage therapist. Then we go to natural treatments. Now I'd like to mention that a few over-the-counter supplements can help you thicken your hair. Some of them definitely have a database of evidence behind the hair growing activity. So to name a few, there's oral saw palmetto, alright, especially good for androgenetic alopecia, and oral pumpkin seed oil. You can also look for some topicals, like topical rosemary oil, then topical green tea and caffeine. They don't have robust data evidence behind them, but if you don't want to go for some officially prescribed drugs, if you want to avoid those, it might be a thing for you. However, if you've done a thorough, step-by-step medical checkup involving your hormonal profile and all sorts of possible blood reports advised by your trichologist, dermatologist, your healthcare certified professional. In other words, if you have finally found a possible cause that affects the condition of your hair, like a non-adequate level of certain hormones, changes in levels of iron, ferritin and transferrin saturation, or certain microelements that you may consider an intake of specific supplementation or even prescribed medicine that will help you to correct the level of hormones and your blood parameters. So what I'm trying to say is that you can try and you should go for natural supplements if you wish to, but at the same time always eat a healthy diet, because from the healthy diet we can sometimes we can't get certain microelements from poor nutrition, or so take some multivitamins or some supplements if your doctor really recommends it. Okay, and now I'd like to introduce you the following therapy, and which is called low-level light therapy. Low-level light therapy, LLT, utilizes visible red light emitting diodes that alter cellular function, such as prostaglandins or cytokines and other bioactive agents that can influence on reversal of oxidative stress, such as that induced by mitochondrial redox reactions. The mechanism by which LLT can induce hair growth are not precise, they are not clear 100%, but still it is suggested that the light might activate dormant hair follicles, increase blood flow to the hair follicles, or percolate the production of ATP by mitochondria to stimulate hair to enter and to prolong the anagen, which means active growth phase. It is appropriate for both men and women. Such at-home laser treatment is appealing, as these treatments are convenient, easy to use, have minimal side effects and are not as costly as continued medical therapies. But I should mention that it couldn't be a stand-alone treatment. It has to be an additional treatment to some other therapy which is more strong, let's put it this way. Such treatment is viable for those with an adverse reaction to medications or should be used as a useful adjunct to other medical therapies, all right? So, okay, we go further. And the next method is hair growth and hair structure improvement with placental peptides and PRP. So PRP have gained popularity in dermatology and aesthetics about 2 decades ago. PRP injections can stimulate hair growth in areas of thinning on the scalp. PRP, which means platelet-rich plasma therapy for hair loss, is a medical treatment in which a person's blood is drawn, processed in a special way in a lab, and injected into the scalp then. It contains a lot of so-called growth factors and other bioactive molecules that can improve hair structure and thicken your hair. And another excellent option to consider is injecting pure placental peptides or their combination with their types of peptides like skin and mesenchyme peptides. Such peptides are extracted, isolated and enzymatically processed from natural sources in specialized labs. What's exciting about this therapy is that it doesn't work only for the scalp hair, but also can help with for your eyebrow and the eyelashes growth. The placenta is deemed as an active and effective therapeutic agent and tool with potent regenerative properties in human tissues that contains a variety of growth factors, families, transcription factors, and cytokines. It doesn't just help for the hair growth, but can help for the wound healing, skin rejuvenation, and so on and so forth. But special consideration in such function is given to polypeptide growth factors, which are referred to as trophic regulatory substances. These factors exert various effects. They may stimulate intracellular communication to initiate cellular response via specific cell surface receptors. They act as messengers and transmit intracellular signals through autocrine signaling, and which act on the same cell that produces the growth factor and responds to it, and the paracrine signaling act on the cells that are adjacent to the producer cells. These growth factors can induce cell proliferation of vascular endothelium and dermal fibroblasts, prolonging anagen active and delaying catagen resting onset in the hair follicle. Thus, hair growth can be stimulated with the help of these growth factors. What is also exciting about these peptides is that you can apply them topically, but their availability may be doubled, if you will, by delivering it via microneedling or mesostemper. All right? So mesostemper is undoubtedly an effective tool that stimulates the hair scalp environment through needling. Thus, it increases the local microcirculation, increases the absorption of cosmetic ingredients into the skin and hair growth, and well, of course, it helps to deliver the hair growth solution to the skin and into the dermal papilla. In such a way, it slows down the programmed process of follicular involution and hair thinning. Usually, microstempers have an ampule and the tip with the needles of different sizes that help deliver the aesthetic solution to problematic areas like the scalp, well, and what we mentioned before, eyebrows, eyelashes, or sometimes even a beard if someone has a problem with the hair growth on a beard. Though needles are tiny, and that is why procedures are almost painless, which is great, right? Microstempers and microneedle are widely used to treat hair loss problems and are efficient for faster results. It's best to discuss any procedure like mesostamping or mesorolling with a medical practitioner before doing it on your own. But if you want to have DIY, if you want to do it yourself, make sure you follow next simple steps. First, clean and disinfect your mesostamper or microneedling device before or after mesostamping or rolling, and make sure that the scalp has no inflammation at the area of application. Second, use small sized needles from 0.5 to 0.75 millimeters to avoid any unnecessary scarring. The third recommendation, please be patient. There is no need to do more than 1, maximum 2 procedures of microstamping or microroller device a week. So avoid traumatizing your scalp too much, because hair has some time to grow. It needs some time to grow. And it will take some time for you to see an actual treatment result. Now, I'd like to share with you some research and clinical results of stimulating hair growth and its structure with the placental peptides and their combination with skin and mesenchyme peptides done by my colleagues and I. So here you may see some photos before and after. So for most of these gentlemen, we've done an entire treatment course, which usually includes from 12 to 15 treatments depending on severity of the problem. The results are remarkable for most of them. Most of them have mesotherapy. It's another way to deliver peptides into the scalp with the help of a syringe or via mesostamping. And as I've already mentioned, all the patients responded very well to the treatment. What I also like to say that peptide therapy is showing excellent results in stimulated eyebrow hair growth. So you're welcome to try this therapy as well if you need to, of course. Well, let's recap what we went through today. So first, we should avoid stress as much as we can. Say no to stress and it will help you maintain your hair's condition. Another option to grow hair is self-massage or massage by a professional. You can find some appropriate techniques online. It's zero cost, pain-free method that may be useful for you. Next, LT devices are great. Sessions are fast and these treatments are suitable for men and women, but make sure you combine it with some other therapies. Then some of you might want to try naturally occurring topical oral supplements and particular specific supplementation if you require it. Remember that you need to approach any new supplementation with the sense of caution and take it only if it is really required. The following therapy is PRP therapy or placental peptides therapy in combination with skin and mesenchymal peptides, so that provides hair thickening or hair growth. So this therapy is good because it's also derived from natural source. The potency is high because of the growth factors contained in such aesthetic solutions. The delivery using mesostamper or mesoroller is not complicated and almost painless. Please adapt and modify whatever suits you from this list, but always consult a trusted healthcare professional before making any decision regarding hair loss problems. And one more thing that I like to add. When patient's evaluation is done correctly and the physician chooses the right therapy, there is a high chance for the majority of the patients to stop losing hair. But you have to be patient. It's time-consuming process. First, you'll see the signs of hair thickening, and you will be able to maintain the condition of the scalp. And if you start to do it at the right time and with the proper approach, you can undoubtedly reverse it. So with that, I wish you all the best. Thank you, and see you soon.